My name is Jennifer Held. I am going to be your nurse practitioner student today, and I am going to perform a complete head, ears, eyes, nose, throat, and mouth assessment on you this afternoon if I have your consent.
You do.
All right, thank you. I'm going to wash my hands real quick over here in front of you, and I'm going to put on my gloves. So overall, you appear healthy, having no distress. You're sitting straight up. You are smiling. I'm not noticing any, I wouldn't tell her this, but I'm not noticing any body odor. Overall, she does appear to be very healthy. Like I said, no signs of distress. She's appropriately dressed. She's not disheveled. I have no problems here so far, so I'll continue on the assessment, noting everything so far is normal. I'm going to assess her hair. Just kind of looking around for thickness, any change in color, anything, anything abnormal. Her head I'm going to check out her scalp for any rashes or raised areas. The scalp appears to be symmetrical and without trauma. Normal cephalic and atraumatic. I'm also going to be checking I'm also going to, while I got my hands up here, I'm just going to be checking her head, checking more on the overall part of the scalp, not just looking at the skin on it. I'm not seeing anything here. Like I said, this is atraumatic and symmetrical. Normal cephalic. Okay. All right, I'm going to look at her eyes. I see nothing. I see a little scar here and maybe a little one over here. No problems though. Her eyes are midline. Nose is straight. Mouth. Everything looks good. Her eyes appear to be very well hydrated. No drainage, no redness, and skin color appears to be normal for ethnicity. I'm sure my patient will forgive me for mispronouncing that one. I'll just say she's white and Caucasian and looks like she's white and Caucasian. The next step will be, I go from here. I'll go and I will palpate the throat. This is my next logical choice. So I'm going to look down. She's already kind of got her chin up, so I'll say keep your chin up. Go ahead and swallow for me. Then I can see the formation there. So the thyroid pop a little there. And then I'm going to check the range of motion in her neck. So I'm going to ask her to put her chin down to her chest. Pick her head up all the way to put your chin up to the ceiling. I'll have you go back to the neutral position and then go to the left and then go to the right. Then I'll have you take your ear and put it down towards your shoulder. Any pain with movement or anything?
Nope.
And the next one, other one. I can see her muscles. Okay, both of her muscles appeared there. Normal, symmetrical, no problems, no pullings, no swelling, no straining there. I am going to go ahead then, and I'm going to, if it's all right with you, check your lymph nodes. Mm-hmm. And I'm going to check, I'm going to count these out. I'm going to check 8 places. 1, and then 2. And I'm going to check below here. 3, and 4. And then I'm going to go right here. 5, 6. A little bit of a lump there, but not too bad. 8 and 9. That was 9. I skipped a letter there.
7.
7? Okay. I did them all. I did check 8 spots though, even though my counting was off. And then I'm going to go ahead and, while I'm in this position, I've already checked the back of her neck. I'm also going to check her thyroid. So I'm going to come over here and feel down for, I'm going to put your chin up all the way. And I'm going to feel for this muscular notch right here, right there. And then kind of like over the ship, there's the other section. I'm going to go down to the thyroid here. And I can actually feel her gland very well. I'm going to push to one side, feel for any masses or anything. Nope. Thyroid gland appears to be symmetrical. I can feel the nodes on both sides. No masses or anything noted. And none noted on this side. No swelling. No problems. I don't sense any goiters or anything. And then I'm going to come to the front And I'm also going to assess this gap around her trachea. And that all feels fine. Okay. Now I'm going to do the back of her neck. I'm going to check up here by the C1, C2, and then continue all the way down to T1 in my assessment. And both assessments, I see no raised areas, no nodules, and everything appears to be fine. It is symmetrical. Muscles appear to be good. No tightness noted at all. And then when you came in, the nurse did check your vital signs, and you were 5'7", 150 pounds. Is that still correct?
Absolutely.
Okay. We also checked your temperature at a 98.9, and that is about your normal.
Yes.
We checked your respirations. We did it for 30 seconds, and then we times that by 2, and that turned out to be 22. And we checked your heart rate, so we checked for 15 seconds, times it by 4, and that turned out to be 77.
Okay.
And the next thing we're going to do is check your blood pressure. If you were a new patient, we check it in both arms, but since you're a known patient to us, when the nurse checked your blood pressure earlier, it was about 120/80, which is right on there. And so when she checked your blood pressure, she pumped it up to about probably 140. And then, like I said, she brought it down about 2 to 3 notches about every second. She would have also probably had your arm, held it out here, and did it to checked your brachial artery to make sure, and then put the pump about right here. And that was not without problems. All your vitals came out normal.
Wonderful. Thank you for letting me know.
Yes. Then I'm going to look at your ears. First, I'm just going to kind of just touch your ears and look for the scars, which we are seeing lots of scars from the piercings, it looks like, and from, looks like, the surgeries that we discussed earlier in her physical history. Big scar here in the back, all around the muscle, and then in the ear, the earrings themselves there. And then the other thing we're going to do is what's called a whisper test.
Okay.
I know you have sensitive ears, so let me know if this bothers you. What I'm going to do is I'm just going to kind of hold down what's called your trachea right here. And I'm going to hold it down and tap it. And I'm just going to whisper a couple things. Let me know if you can hear it.
Hat and bat.
Okay. And now on this one.
Cat and hat.
Okay. Normally I'd whisper a lot softer, but I wanted you to be able to hear it for the recording. And since she has no problems there with her hearing, I'm also going to use the tuning fork, do the Webster's assessment. So I'm going to activate the tuning fork by pushing it on there. And then depending on what paper you read, I'll either put it here, most people put about here. And you ask, can you hear this better in one ear or the other?
Nope, sounds the same.
Okay. And then you're going to, since it's probably stopped activating, activate it again. And I'm going to put it right on her mastoid.
And I can hear it.
Okay. Let me know when the hearing stops, or when the sound stops.
Okay. Stopped.
All right. Can you still hear it?
No.
Okay. And I'll activate it again.
I can hear it.
Okay. Let me know when you stop being able to hear it.
Stop. Yes, I can hear it. I can hear it.
Okay. On this side, I might, like I said, we would probably refer her to hearing test if it continues to be problems for her, but the patient said it's doing okay. So now I'm going to check into the ear. I'm going to turn on the otoscope, make sure it's working, and then I'm going to place the otoscope. I'm going to use my hand here, place it against her cheek. Which I'm going to pull this up, back, and away. And on her ears, I am going to see a tympanic membrane with a hole right in the middle where she had previously told me she had tubes put in, those Aerostation tubes.
Yes.
Put in her ears from before. So I am able to see part of the membrane, and then I also see the bottom part where it has been punctured. But the membrane is still there, and I can still see part of the inner ear. And so what's good for one is good for the other. So like I said, I'm going to properly hold this here. And this one is a little less. Actually, I can see a little bit more of the membrane there. And I can still see the light reflecting. And I can see the other parts of the middle ear also. There's no swelling though, no drainage. Actually, not even any no earwax. Looks to be doing pretty good.
Okay, wonderful.
Yes. Okay. Now we are going to assess your nose. I'm going to put a new tip on the end here. And I'll grab that in a second. What I'm going to do right now is I'm going to kind of just look at her nose. It looks symmetrical. There's no bulges. She does have a little bit of red papules on there, but otherwise just known as acne. That happens probably from wearing masks too much. And then I'm going to look at her nose. The nares are equal, no deviation. It does look like her left nostril is a little bit smaller than her right, which is not uncommon. All right, I'm going to have you hold one of your nostrils. Take a deep breath in and out, and switch. And out. I know it seems kind of funny, but any pain, problems, stuffiness?
A little stuffiness on that one.
Okay, that would be the smaller nostril. All right, so what I'm going to do now is I'm going to take the little otoscope and I'm just going to look straight up. And looks red, moist, well hydrated, well vascularized. And this one's a little bit larger. Like I said, it's not red, no bleeding, no hemorrhage. Looks pretty good. Like I said, well vascularized, well hydrated. No problems, no polyps or anything. Looks pretty good. One side's larger than the other, but completely normal, and that just happens sometimes. It's not causing you any distress at all?
Nope.
Okay. Okay. Now I'm going to check your, well, we did your head, ears, throat, nose. We'll do the eyes because then we'll do your mouth last. Okay. So what I'm going to do with your eyes is I'm going to first have you do a little vision chart.
Okay, so I have my glasses on?
Yes, you will need your glasses on for this. And I'm actually going to use a little note card. I'm going to have you first cover up your left eye.
Okay.
That's a further. And I'm going to have you read the smallest line down. I have the Snell chart is about 6 feet away from her.
C-E-F-P-O-T-E-E-C.
Yep. And I'll have you switch eyes. Okay, go ahead and read me the smallest line you can again.
D-E-F-P-O-T-E-C.
Okay. And now the trickiest part, both eyes. What can you read?
D-E-F-P-O-T-E-C.
Okay, now that is 20/20. That is her vision.
Yay!
So like I said, that means that the average, she can read 20 feet away, where the average person. Oh, I did it wrong. Sorry about that, but I am glad your kid's okay.
Thank you. Sorry.
So, 20 feet, for 20/20 means that you can see things like about 20 feet away.
Okay.
So now the next test will be the vision test to check your peripheral vision.
Okay.
So what I'm going to do is I'm going to wiggle my fingers, and I'm going to and you're going to see. So tell me when you can first see them. Oh, actually, sorry, one at a time.
Yeah. Yeah.
Okay. And now, like I said, keep looking straight ahead. I forgot I told you that earlier because you were perfectly staring straight ahead there. So like I said, I'll keep having you stare straight at that pink cup there.
Okay.
Okay, so tell me when you can see them.
I can see him.
Okay. Okay, now if there was a deficit or something, or any concerns, I would do this individually to each eye, but to save time because we're getting close here, we won't do that today. But like I said, I would cover up one eye and then we would do the exam again and repeat it.
Okay.
The next part is going to be where I'm going to have you look at a pencil. And I'm going to have you look. So I have a pencil here. And then I'm going to have a little red cap here on my shoulder, actually the pocket of my hoodie. So I'm going to have you follow the pencil with your eyes. And I'm going to look for your eyes to get smaller. And keep following, keep following. And then I'm going to put the pencil here. And now I'd like you to look at my jacket. And look back at the pencil. And look back at my jacket. Okay, and her eyes are dilating and constricting as expected. Like I said, when she's focusing on the pencil, they are constricting. When they're looking away here, they're dilating. No problems there. And so now I am going to use the ophthalmoscope. If I'm pronouncing that one right. And I am going to check your eyes. First, I'm going to palpate though a little. I'm going to check your eyebrows, make sure they're equal. There's no swooping or drooping. Her eyelids are normal, symmetrical. There's no signs of trauma. They look pretty good. I'm palpating the lacrimal duct here. I'm sorry, the duct is down here. I'm palpating the lacrimal sac up here. No changes. I am going to lift up on both of her eyelids. And sclera is normal. You can see the good blood vessels. I'm going to have you look down. And then I'll have you look up. No problems. Her eyes are well lubricated, good vascularization. I'll have you look to the left. And I'll have you look to the right. Okay? And while we're doing that, I'm going to have you follow my eyes, or follow my finger with your eyes. And I'm going to have you just follow my finger with your eyes. Sorry there. And I'm going to go 1, 2, 3, 4, and 5, 6. Okay, good. Any dizziness or lightheaded?
Nope.
I was looking there for any movement of her eyes. The eyes stayed normal. What I'm going to do is, I'm only going to do it to one eye to save some time. I'm going to darken the environment around us. The environment is darker. Okay.
You want the light switch?
Okay.
Yes.
Okay. I'm going to darken the environment. Sometimes you guys improvise. So I'm going to use this little scope. Okay. I'm going to use the scope. And I have a light scope. And I have a red. I can see the red light there. Oops. I'm going to put it about here. I'm going to get nice and close. I'm going to have you look straight at me. All right. Whoops. Sorry there. And I'm going to see. Yep. I can see the red zone. And then I can see her optic. Yep. And we can see it's well vascularized, well hydrated, and is orange in color. No draining, no edema. Looks pretty good.
Okay. Thank you.
All right. And then everyone's favorite part, the mouth. With this, I'll be using just a regular gauze and a tongue depressor. All right. I'm gonna have you open. First, I'm gonna have you smile, and I can look at your teeth. Her lips are moist. They're not dry, cracked, no lesions, no sign of trauma. So I put you on the spot like this, and we're gonna look at the teeth. No problems there. Okay, can you stick out your tongue for me? Can you move it to the side? You've done this before. Okay. All right, so now I'm going to look in the back of your throat. Like I said, I'm just going to check it out. Just going to put it on your tongue. If you start to gag or anything, tell me. Oh, yeah, that's right. I need to. And I will visually inspect. Okay. And everything is in good place. I can see her uvula. It's in the middle, non-deviated. Yes, I can see her tonsils. No swelling, no drainage. I'm sorry, I know it's uncomfortable. Okay, and I'm going to look at her teeth. No problems there. The gums are in good condition. No bleeding. No signs of cavities. Looks pretty good. And now like I said, now I'm going to palpate. So I'm going to use some gauze. Sorry to be uncomfortable here. I'm going to use it to grab your tongue. And I'm just going to palpate. Make sure. Let me get my stick again.
Good thing you had 2 set up.
Thank God. Okay. And yep, doing pretty good there. No change. And I'm going to move there so I can check the hard palate. Check under. Yep. No problems, no drainage. Probably need a drink of water after that. Okay. It looks like your tongue is her tongue and the rest of her mouth. Mucosal membrane is moist, or is well hydrated, well vascularized. I see no signs of infection, trauma. The mouth is completely symmetrical. And we seem to be doing pretty good.
Okay.
Unless you have any other questions, that will be it for today.
That was great. Thank you.
All right, thank you. Oh, did I hit the wrong button?